All right, and I'm going to hand it over to Zul.
Good afternoon, everyone, and welcome to our second CDOC annual members meeting of the year. So thank you. We're so happy that you all could join us today. We have a packed agenda, and so I'll go over the agenda and some housekeeping. So let's go to the next slide. So just, everyone's been muted. If you'd like to ask questions, drop them in the chat box. Of course, this webinar is being recorded, and that the recording will be sent out on our listserv and will be posted on CDOC online net. So let's go to the next slide. I see everyone's posting their organizations and their favorite candy in the chat. So an overview of the agenda, we're going to have cancer updates, introductions, work group updates, a tour of the cancer plan, our 2021-25 cancer plan, and have discussions and updates on the cancer plan implementation. And then we'll end with Q&A and discussion. Next slide.
Zul, you're muted.
Sorry, I don't know how that happened. So this is our leadership team. Raquel Arias is the vice chair, and she represents the American Cancer Society. Stoney Anderson, Dr. Stoney Anderson represents the C4 Coalition, and of course, Shantae, who makes it all happen, the director of Comp Cancer. And then I wanted to also acknowledge the hard work of the executive committee, which really comprises of many experts in different areas, including areas of health equity, specific populations with disparities. They also represent geographic areas of our state. And please visit CDOC online net to get more information on their bios. And I'm going to hand it over to Shantae.
Great. Thank you, everybody, for joining. And I'm going to jump right into some updates because, as Zul said, we do have a packed agenda today. Some good news for Comp Cancer. We do have a new part-time staff coming on board in November around that time. So stay tuned for that. And what that means is we will have some help in managing our coalition functions. This person will help with CDOC Workgroups, communication. So we'll be able to have, you'll be able to have more updates from the coalition and what's going on. They'll also manage our Cancer Centers collaboration, which you'll hear about a little bit later. And also another function under Comp Cancer is the California Cancer Control Leadership Team, which is a collaboration of all the state-funded, CDC-funded cancer control programs. It's not going to the next slide here. Let's see here. Oh, sorry, it's froze there. Okay, sorry about that. Here we go. So I just wanted to give a quick update on our grant funding. We are in the last year of a 5-year CDC grant that 2017 through 2022. We get around $463,000 annually. That changes every year, but this year we stayed at our funding at around that level. And those funds are primarily to support our cancer plan implementation. And we'll talk about those projects that those funds are supporting. And we are expecting a new funding opportunity announcement to support Comp Cancer, which we will apply for. And we're expected to receive that FOA in November, and usually they're due the next year around February. So a quick update on the cancer plan. It has been laid out in a PDF version. There's the cover. We're going to do a tour a little bit later, but we still can't post it because we're working with a contractor to ensure that it's ADA compliant and it does pass the CDPH ADA compliant guidelines. So that's the holdup at this time. But again, we'll be able to take a tour of the plan, and you can still look at the plan online. And we are also working on a summary document of the plan because it's a very long document. So that will be available as well. And then the dissemination plan will also be rolled out more robustly once we have our new person on board and we have the summary available too. But as most of you know, we have started to disseminate some of the content through our 2021-2025 Cancer Plan webinar series. These webinars give an overview of topic areas that are in the plan, along with practical examples of how to implement some of those strategies from some of our partner organizations. We've already started that series in March. And so we have webinars that are available for our colorectal cancer section, our survivorship, treatment and survivorship section, and our health equity section. So I encourage you to go online and you can take a look at those webinars. And again, as we get our new staff on board, we're going to make a more robust plan and continue this webinar series for the other topics that are in the plan. Now we're going to hear from all of our contractors that are working on cancer plan implementation projects for this meeting. Our cancer survivorship contractor is still pending, but we will be working with the Stanford Cancer Institute. They will be developing a CHW curriculum for cancer survivorship. So we're very excited about that. But we'll hear from those other 3 projects there a little bit later. I know this is kind of a busy slide, but I just wanted to highlight another project that wasn't just recently funded. This is sort of an ongoing project that has been under our 5-year grant cycle, but we are funding a project with UCSF, the Zuckerberg San Francisco General Hospital. The goal of this project is to close gaps and reduce disparities in colorectal cancer screening by improving the completion of diagnostic colonoscopy following abnormal FIT in vulnerable populations. So as you know, most of our projects do focus a lot on getting folks screened, which is very, very important. But the other piece of that is to ensure that if there is a positive FIT found, that there's the appropriate follow-up that's happening. So the PI on this is Dr. Ma Sumsuk at UCSF, and they're making great progress there. They now have an EPIC FIT positive report that's up and running. And the report that just meeting with him, they currently have a 49% colonoscopy completion after 6 months. They're developing best practices for patients who have not been referred and who haven't been scheduled or who have missed their colonoscopy, and will of course be doing some analysis to examine, why those colonoscopies haven't been completed. So just wanted to give an update on this project as well. Dr. Sumsuk was not able to join us for this call to provide this update. All right, now I'm going to turn it over to Zul.
Thank you, Shantae. So many of you know that NCI designated comprehensive cancer centers and emerging cancer centers have a new requirement for community outreach and engagement. And I guess it's not that new anymore. It's almost 2 years old. And so comprehensive cancer centers have been really engaged with CDOC, first to help write the cancer plan. And now we were able to bring cancer centers together. We formed a Cancer Centers Collaborative. In May of this year, we had a very productive conversation with cancer centers in California. While a lot of the feedback analysis is pending, but we've identified, specific areas of collaboration. So like areas of outreach and engagement, research, policy, clinical trials. And so we're looking to, start, and these are the recommendations that came up to better coordinate activities around specific cancer sites, to jointly develop interventions and education campaigns, to think about policy issues and initiatives at local, state, and federal levels, and then share best practices and leverage shared resources. And then also building the infrastructure. And, I think that this is a big area for us all, is to encourage minorities to accrue in cancer clinical trials. And so these are conversations that are coming up within this group, and we're really excited about the collaboration and moving forward. Back to you, Shante. Oh, sorry. Handing it over to Raquel.
Hello, everybody. Thanks for having me on to give some American Cancer Society updates. And today the theme is going to be screening. And I'm also going to talk about how ACS is partnering with CDOC on our Get Screened campaign. Next slide, please. So first, just a couple of newsy items. The American Cancer Society is in the process of updating our lung cancer screening guidelines. So in the meantime, if you go on the website, they're down, but we're referring folks to the U.S. Preventative Services Task Force and to these other organizations for their screening guideline recommendations. And next slide. We do also have a really excellent series. Our National Lung Cancer Roundtable has a 7-part series of lung cancer screening webinars. I caught the last one and was really impressed. Also, if anyone doesn't know, I know Zool has been sharing this, that California is the second to last in the country as when it comes to lung cancer screening. So yeah, we have a long way to go, and they're through these webinars and through a lot of the resources available, explaining some of the issues, challenges. Eligibility is definitely very different than it is with a lot of other the recommended screening. So wanted to make sure that you all knew about those 2 updates related to lung cancer screening specifically. Next slide. And then I'll jump back to screening and the Get Screened campaign in a second, but a few ACS CAN updates. This is our Cancer Action Network. This is a big week for ACS CAN. We just wrapped up our National Lobby Day that took place earlier this week. And I won't go bullet by bullet here, but this is some of what ACS CAN ambassadors advocated for with members of Congress. So the first one does have to do very much with screening and coverage of innovative new early detection tests. Also increasing access to care by expanding marketplace premium subsidies, increasing cancer research funding, of course. Oh, and then the National Breast and Cervical Cancer Early Detection Program funding, also very, very important. Of course, every woman counts for us here in California. And then in California specifically, the 2 bills that are on the governor's desk is the Gibson bill, AB 342, which would remove the copay for a follow-up colonoscopy after a positive FIT test. Very important, we've tried it before. And then SB 310, the Rubio bill, which is Cancer Medication Recycling Act. Next slide. We do have an event coming up for ACS CAN. This is a policy forum on November 18th. Let me put the link to register actually in the chat so that you can all take a look and register at that. I'll do that after I'm done speaking. Next slide. And now we'll go to the Get Screened campaign. So you can click through some of these. Thank you. So we are with partners, of course, leading a comprehensive multi-sector national movement is what we're calling it, to just really dramatically and swiftly change screening rates through local and regional stakeholder engagement and action. So work we've always done, but with a renewed urgency because of the pandemic, to really get screening rates back where they need to be and beyond that, because we know, of course, a lot of people weren't screened before the pandemic and they're still not screened. Next slide. So lots of different components to this. I won't go into each of these buckets, but the public awareness campaign is one that's particularly relevant and having to do with our work with CDOC. Next slide. So the public awareness campaign, our national or the public landing pages are here, the English and Spanish one. They address, we're looking through our public awareness campaign to address particular barriers, specifically fear, procrastination, lack of insurance, and lack of symptoms as barriers for not getting screened. So I encourage you to visit that landing page. I really have found it useful in answering individuals' questions about screening, and then certainly pulling that message for some broader work. Next slide. This is some of what it looks like, some of our ads. Again, everything is in English, Spanish. And next slide for CDOC. Okay, so what we're doing is we did get some Pfizer funds, $26,000 for California to boost our state work around Get Screened. And we have used it, doesn't need to be used by the end of the year. We have used it to partner with CDOC. We formed an ad hoc cancer screening work group. Next slide. And this was sort of born out of the health equity work group, but we did open it up to the CDOC listserv. We've been meeting for about a month now, and we're really aiming to customize and disseminate ACS's Get Screened public awareness campaign for audiences in California, and then also convene, inspire, and equip stakeholders that can drive this work forward in California. So the next slide is the last one, just a quick visual of some of what we're working on. We're doing some paid advertising. We're working with the ACS communication staff on, in addition to what ACS is already doing around this campaign. And then we are launching a 6-week Get Screened California social media campaign. So you will all be hearing more about this, and hopefully you and your organizations can participate. So this is using ACS's national assets, but then the work group is also going to create some new assets with essentially new spokespeople, like creating social media reels, for example, individuals from particular Asian groups taking that message forward about the importance of cancer screening. So we'll have a whole social media toolkit, make it really easy to participate. That will be December into January. And then we're planning on also having everything up on a simple place to be able to get those resources with a simple website and that virtual stakeholder meeting I mentioned a second ago. We're looking at early December, so certainly we'll push it out to the CDOC listserv at that point. So this is all just exciting work happening on multiple fronts. This is just one of the exciting things going on when it comes to cancer screening, but really happy to be partnering with CDOC on cancer screening, the cancer screening public awareness campaign. Thank you. Happy to answer questions in the chat.
Okay, so now we're going to hear from our CDOC work groups. We have survivorship, colorectal cancer, and of course our new health equity work group. I just wanted to note that we do have liaisons for those of you who are new to CDOC who serve to update our membership on these various topics, and they have a seat on our executive committee. But they do not have dedicated projects. So I'm going to turn it over to our first work group, colorectal cancer. So Stony or Margaret, if you guys can.
Yeah, I will take the first slide. First slide, please. Yes, our current focus is to develop a CME program that will address the new U.S. Preventive Services Task Force guidelines. They came into compliance with the ACS guidelines recommending starting screening at age 45, and how that is going to be implemented is going to be very interesting. So we will try to educate on the best ways to do that. And then the second one is on the colorectal cancer screening quality measure that will be added to the CMS adult quality core set for Medicaid patients. The reason this is important in California is because if it's added to this adult core set of Medicaid patients, then it's added to the California Medi-Cal core set of quality measures. So the insurance companies will have to report their colorectal cancer screening rate in their Medicaid patients. And it's going to be low because in 2020, most of the federally qualified health centers patients are insured by Medi-Cal, and the screening rate in our federally qualified health centers went from 46% to 37% with the COVID. And we'll also provide technical assistance because we have some projects that CDOC has funded with federal qualified health centers in the LA area. And we'll work with them to make sure that they can increase their screening rates. Next slide for Margaret.
Hi. Next slide. There we go.
There it is.
Yeah. So I'm going to talk about, so we have our upcoming Western Colorectal Cancer Consortium Conference, which was originally planned for March of 2020 that we rolled to October of 2021 with the hopes of having it as an in-person meeting. And unfortunately, we had to make the decision to move it virtual because of Delta variant of COVID running rampant through the country. Although, you know, some places in California, we seem to be doing better than most. So the conference is in 2 weeks exactly. So October 14th and 15th. And for registration is $100 for regular attendees and $200 if you're representing in industry. And we have an updated CME credit hours of 13.25 through AAFP, so American Academy of Family Practice. And so we're with presentations on optimizing screening. We have all the experts in the field that are going to be here presenting on all the ins and outs of colorectal cancer screening. And we have robust sessions on addressing health disparities and racism. And then also looking at evidence-based interventions. We have a cohort of panelists that are representing our C4 funded federally qualified health centers and the struggles, kind of their successes, and then some of the overlying struggles that are imposed by the COVID pandemic. So we hope you can join us, and I posted the direct registration link into the chat. Thank you.
One other thing that Margaret didn't mention, if you are around any fellows or residents that are in training, their registration is free because we want to get this information out to the trainees.
All right.
Yeah, and can I also add in? So another thing, so we have a survivor segment that kind of to reemphasize the importance of training clinicians early and retraining them often, is that many of the survivors, including those that are presenting, but also additional that will be in attendance, have stories about physicians ignoring their symptoms. And so, you know, we need to really refocus on, you know, not only the normal risk population, but those who are presenting with symptoms. Thank you. Sorry, Shante.
All right, thank you. Okay, so next we have our health equity work group. Here are our three co-chairs here. And today we're going to be hearing from Shannon from Equality California to give our health equity work group update.
Hi, thank you, Shante. Yes, everyone, I am Shannon, she, her, hers pronouns from Equality California. And the health equity work group update is we have a plan, we have a strategy, and we have a list of things that we would like to accomplish in the work group. And this is in large part and a huge thank you to a lot of the organizing work that Midori did within the work groups. So fantastic. Our focus is planning for a data project that we are calling Sexual Orientation and Gender Identity Plus, or SOGI Plus Data Project. And this project is focusing on ensuring the cancer burden for sexual and gender minorities is represented. Have a lot of these data that are being collected. And so we don't have a way to look up and get a good view through the cancer registry as to what the cancer burden is for the LGBTQ+ community. The way that we are hoping to approach this is to add a non-binary identity category to the current cancer registry data dictionary, with the goal to make sure that the data that can be captured now matches California's state identification laws. And this effort includes collaborations with national entities, and we have already begun to do a lot of this work. We're also hoping to do a data collection pilot with our cancer center partners. And these pilots are aimed at collecting data that will allow us to review and evaluate existing sexual and gender minority measures or sexual orientation and gender identity options that are being collected already in patient populations. And we're hoping to get some projects going that survey patient populations about their satisfaction and able to analyze the data to understand intersectional barriers. So if there are differences in how LGBT people of color interact with a lot of these data questions versus white LGBT people and intersectional identities like that. And then we're going to launch an education and awareness campaign, mostly focused on developing a white paper and webinars and other types of educational training and events that hopefully will be inclusive of all of the things that we learn and are able to accomplish in the other points. So yes, thank you very much for your time, and I'll hand it back to Shantae.
All right, and now we'll hear from Catherine Thompson from our Survivorship Workgroup.
Thank you, Shantae. Good afternoon, everybody. I'm Catherine Thompson, she, her pronouns, and I am on unceded Ohlone territory. We are very excited to have started a new project in the Survivorship Workgroup with a resource listing. So we are pulling together different resources from around the state and sources. Ideally, this will be a searchable source, not a repository, but a listing. One of the requirements, of course, because the California Department of Public Health would have to review and okay everything if it were to be housed on the state website, is that we will be finding another location to actually have this online. Some of the topic areas that we're going to be focusing on are listed here. And the idea is that we will be trying to reach various audiences in different ways. So different languages and different types of materials, videos, physical materials that can be downloaded, etc. So we're going to be starting out with documents, and one of the things that the Survivorship Workgroup had done in the past was the survivorship care plans materials. So that toolkit will be one of the kinds of things that we would like to make available. We also, of course, have been in contact with the cancer centers with their we hope that this will be one of the ways to share and leverage the resources that the cancer centers have developed. Also, because of course, physical activity is one of the goals of the Survivorship Workgroup, we hope that that liaison group will also be helping out. So we will be reaching out, and we would welcome others to join in and help us with this effort. Would my co-lead, Elizabeth Klein, like to add anything? Did I miss anything?
You've got it all, Catherine. Thank you. That's good.
Okay. Thank you, Elizabeth. Thanks, Shantae.
All right. Thank you so much. Okay. I just want to note that I do have an unstable connection here, so I might go in and out, but right now I'm going to move on to the tour of the cancer plan. And I just want to note that I'm going to put it in sort of the two, so you can see both pages. So it looks very small, but in order to sort of expedite the review here, that's how it's going to be presented. So this is the plan. And we chose to take pictures of all over California. So we have northern, central, up north, and southern California there. We, of course, have our letter from the chair. I want to point out that this plan is dedicated to all Californians whose lives have been affected by cancer, but we do have a special dedication to Dr. Tony Yancey, who most of us know and have worked with. Our table of contents here is hyperlinked. So it is a long document, as you see. So you'll be able to click on whichever chapter you need to. Another feature here is that we, and most of you know, because some of you have submitted photos of coalition work and different projects that have contributed to cancer plan implementation. So we have those photos included throughout. There's also a progress summary here of the objectives in the 2016-2020 plan. And even though this plan wasn't widely disseminated, most of you know that we, the Comp Cancer Action Plan is always based off of objectives in the cancer plan. We did have a full plan with objectives included. So I'm gonna keep going down here. And then we highlight progress that was initiated by CDOC. So we call out specific efforts. One is our the collaboration with the American Cancer Society and increasing HPV vaccination rates in the formation of the California HPV Vaccination Roundtable. We have work with the California Colorectal Cancer Coalition listed. Then we go here to the cancer burden, where there's always data on all of the cancer or cancer incidence and mortality, and then survivorship. And then we also have a special dedication to Jenny Cook. And most of us know Jenny Cook. She did unfortunately pass in January of this year, but we have a nice dedication here, and she is our champion of cancer control. We go through surveillance, and then we have a section on emerging cancer trends. So as most of you know, the cancer plan is laid out based off of those the National Comprehensive Cancer Control priorities, but we know that there are also certain cancer trends that may not be included in that in those priorities. So we have listed those there. And then we also feature survivor stories. So there are survivor stories featured throughout. And we do have a new chapter on cancer centers and programs. This is this chapter is the result of a meeting that we had a couple of years ago, actually, and we were hosted by UCSF, and it did result in this specific chapter. And now, as Zul talked about, we will be having a dedicated effort where we have the cancer centers collaboration. Here's our cancer-related health disparities chapter. And if you take a look at some of the strategies here that's related to our SOGI Data Plus project. We do have a specific chapter on, or section on, the cancer in American Indian Alaskan Natives, and we do feature the California's Tribal Cancer Plan as well. We have equitable access, and then we start to go into primary prevention, where we have the specific cancer types. So we start with obesity prevention obesity prevention, tobacco use. We go into breast cancer prevention. And then here's our early detection and screening. I'm sorry, breast cancer is under early detection and screening. Another survivor story. Another thing I wanted to point out is after each chapter, we do have more information and resources, and these are all clickable links. So you'll be able to get that information. And we also have clickable links in the strategies as well. So those are all listed. And then just going down, treatment and survivorship, and then research. And then at the end of the plan, we of course have an acronym list. We have resources for evidence-based interventions. We have all of the data sources that are used in the plan. And then of course we have our executive committee. And then a lot of you are listed here and our contributors. So big, long list of all of our cancer plan contributors. And then we have our call to action. One other thing I wanted to highlight is the cancer plan is now on our website. So if you click cancer plan here, you can go down, you'll see our PDF is coming soon. But if you click on here, you can go to the specific chapters. So you can go ahead and take a look at that. And also under resources, we list all of the resources that are included in all of the chapters. So all of those really great information, all of those resources are listed here as well. All right, so I want to jump back into the presentation. And remember, if you have any questions, please include them in the chat. But right now, I want to introduce Dr. Kimlin Ashing to give us an update on the City of Hope's project for colorectal cancer screening. Kimlin, are you on the line?
Yes.
Okay, great.
Thank you so much for joining the CDOC meeting. And we are, fortunate to work with CDOC to implement the colon cancer screening. So next slide, please. So we see that our colon cancer screening rates in California is also lower than the required screening. However, in Los Angeles County, as a whole, we have lower screening rates. And therefore, we have responded, focusing on LA County with specific targets, reaching San Gabriel and Antelope Valley. Next slide, please. So we have a two-prong project in response to this. The first one is a broad, sweeping integration with the FQHCs. And so we aim to increase the rates from about 52% to 70%, targeting the staff at the FQHCs. And the second would be, reaching through multimedia, multi-ethnic, multilingual campaign to increase awareness of low-cost, non-invasive FIT screening in LA County. Next slide. So these are our partners. And like you see here, we're targeting the San Gabriel Valley as well as the Antelope Valley, and certainly partnering with CDOC and C4 that already has a rich resource on colorectal cancer screening, as well as the American Cancer Society. Next slide. So these are our media partners and outlets. As you can see, we're targeting the Chinese and Korean and Filipino community in terms of the Asian population, but open to partnering with other partners as well, who can help us do the translation to reach other populations. And of course, the African American community that's particularly burdened, and also the Hispanic community. And we would also reach a broader population through our social media outlets with our partners. Next slide. And so these are some of the materials that we'll be using with our clinic partners. These would be posted in the clinic and used in the training for the FQHC staff. Next slide. And these are patient-facing in-language resources that we will use, with our, patient population. Next slide. Down or? Oh, thank you so much.
Thank you, Kimlin. All right, so next up we have Listonic Free Clinic, and we have Richard Aviles, who will be presenting for Listonic.
Good afternoon, everyone. My name is Richard. I'm the health educator at Listonic. Next slide. So a little bit about Listonic is that our mission is to provide free healthcare services to low-income and uninsured residents in Southern California. We do have clinics in the LA County, Riverside, Inland Empire, San Bernardino, and Orange County. We do provide 17 specialty care services to uninsured residents at no cost through our 14 satellite clinics. Next slide, please. So our mission and goal with FIT screening is to decrease the significant disparities in screening rates among the uninsured. Specifically, we're targeting the Hispanic and Latino community. Most of our patient population, about 90%, is Hispanic and Latino descent. So that's our goal, and to decrease significant disparities. The goal is to educate 4,000 patients and screen 500. Currently, we have screened 155 patients, and that has resulted in 2 positive FIT tests thus far, who I believe have been scheduled for a colonoscopy already. I'm not completely sure, but yes, two positive FIT tests have been scheduled. The completion rate for FIT is 39%, which is a little bit higher than the national average reported by the CDC. Something unique about Listonic is that we have a free low to no cost surgery program that works out of Beverly Hills, and we schedule our colonoscopies and any small little surgeries that we offer through them for the uninsured patients that we have. Next slide. So our future plans is to continue with colorectal cancer screening and working with our partners of UCLA from the Johnson Cancer Department to develop a data analysis plan and collaborate and interpret all the findings that we have. Our other goal is to hold 36 community health outreach events or patient education classes, and we hope to start in November. And that is it for me. Thank you.
Thank you, Richard. Okay, now I want to bring Wendy on from Equality California to talk about their HPV vaccination project.
Hello, everyone. My name is Wendy. My pronouns are she, her, hers, and I'm presenting on behalf of Equality California's Diversity, Equity, and Inclusion Training Program. So first, I want to start by saying a little bit about who we are. So Equality California brings the voices of LGBTQ people and allies to institutions of power in California and across the United States, striving to create a world that is healthy, just, and fully equal for all LGBTQ people. We advance civil rights and social justice by inspiring, advocating, and mobilizing through an inclusive movement that works tirelessly on behalf of those we serve. Next slide. So here's a little bit more about our training program. So our training is designed to empower healthcare staff to serve the LGBTQ population in a sensitive and respectful manner. We've developed an engaging interactive training model, and we want everyone to become comfortable and conversant in LGBTQ concepts and terminology. We also want to equip healthcare workers with the necessary tools and knowledge to build and maintain positive relationships with their LGBTQ clients. To date, we have delivered this training to over 3,000 service providers. Next slide. So now I would like to share a little bit more about our project. So earlier this year, we adapted our LGBTQ 101 live Zoom trainings as self-paced online trainings, so they're more accessible to healthcare providers and fit in their schedules, things like that, right? Many of our healthcare partners took that training this summer and gave us their feedback. Now we've developed a new course to supplement this training curriculum, specifically dealing with how the healthcare providers can increase vaccination rates for their LGBTQ community, but specifically trans and non-binary youth. We aim for this training course to equip all healthcare staff to understand the importance of increasing these vaccination rates, and what their role is to assist in this. Our training asks healthcare providers to learn more about the LGBTQ community in order to understand how to better serve them. We also introduce them to the announcement approach and how they can best use that with their LGBTQ patients. And by the end of the training, we ask that they share their concrete research-based goals for increasing vaccination rates so that we can assess their success 3 months down the line. We had our soft launch this month, and we're gearing up for a more impactful outreach campaign in just a few days. So thank you.
Great. Thank you so much, Wendy. And I know we kind of rushed through things, but I just wanted to make sure that we had enough time for everyone to hear about all of our contractors, all of the projects that were going on. And so I'm going to stop sharing here, and so we can all see each other. As it said on the slide, this is an open forum. So now we really want to hear from you all. And if folks have any questions, we want to hear what that is. I will I'll take a look at the chat, but at this time, if you want to raise your hand or just come off mute, if you have any questions or anything like that for any of the presenters or for our CDOC chair, or for myself.
I was, Shantae Stoney, I was wondering the size of the free clinic that's working on the 4,000. That may be a pretty good percent of their people that are 45 to 75.
Richard, can you respond to Stoney, please?
I'm sorry, Stoney, what's your question?
The size of your clinic, have, you know, the number of people that visit within, I think it's 2 years, what you have to report.
So
free clinic, yeah.
we see about, on average, year to year, about 10 to 12,000 patients. We do have 3 primary clinics, one in Orange County, one in Norwalk, Compton, I believe, and 4, and San Bernardino that see the most patients. The other satellite clinics are more of RV based. Those see smaller amounts, but everybody gets referred to a bigger clinic. So either one of those 4. But yes, our numbers are around 10 to 12,000 on a yearly basis.
So the 4,000 that you're educating and trying to get screened with a fit test covers almost all of your 45 to 75-year-olds.
Yes, we do expect to meet that 4,000 number by next year. So I don't think we'll have any problems. Most people have gotten their fit or their colonoscopy done, but those who haven't, we're offering the fit exam. And we are also doing outreach events. Like, for example, a couple months ago, we went to the consulate, the Mexican consulate, and we were offering services there too. So we will be doing more outreach events throughout the year as well, when appropriate, and hopefully get more patients through there too.
Yeah, the return rate on your fits in the 30s, you're right, that's probably typical for federally qualified health centers, although we've worked with some that are in the 40s. And then when you get up into systems like Kaiser that have a robust system to encourage people to return the fit test, you get up in the 60 percentile. So that's probably something that you can improve over during the period.
Yes, that's very true. I have seen that, and I have read about that. But yes, so the 31% is the national average. We hope to be somewhere in the 50s and 60s, but we're working hard for that.
That's great.
Yeah, quickly, this is Ndukako Melo, just to follow up with what Dr. Anderson just said. I was just also wondering, what are the strategies that you guys are using to have the patient return their fit kit? So what we've done with C4P is that we use multiple strategies, which include patient navigation, And also we use mailing fit. So you can consider those because it has high adherence for fit return rate. So it can actually help you to increase your fit return rate. So, but strategies matters a lot. So you have to not just use one strategy, but have more a comprehensive strategy on how to get patients to return their fit.
I agree. Some of the strategies that we have implemented is I don't have with me right now, but I can share it to anyone who's interested. We've also created more educational flyers and that sort to meet the needs and wants of patients in Spanish and English. So,
okay,
those are good points in terms of strategies to improve return, because that's what we've heard from our clinic partners.
Yeah, I agree. That's excellent work. The problem with the a lot of your patients are homeless, as I understand, and a lot of the strategies have mailing reminders to mail the fit back in and that sort of thing. And have you looked into, do most of your homeless have cell phones? Have you looked at text messaging? There have been a little bit of work on texting people to get fit tests back.
yes, we have looked into it. However, our population is mostly Hispanic and Latino, and we do offer the mailing service and everything, but we have noticed that for some reason, most Hispanic families and Latino families don't necessarily want to go to the mail to drop this off. So we do offer in-house a service for us to testing center. So we do offer both services, but for some reason we've seen and we've noticed that families don't necessarily want to go to the mail post office or anything like that. So we do offer for them to bring it back to our clinics, and we put the order in for LabCorp to pick it up.
Excellent. Yeah, it's a different population. You're doing good work.
And also, another thing Dr. Anderson just pointed out, the time for reminding is very important. In C4P, we usually try to remind a patient 7 days after their fit is handed to them, because after that, they're gonna go into recall bias and they're not gonna be able to comply to return their fit kit. As soon as possible, if you hand them over fit, call them within 24 hours just to make sure that they understand what to do about it, and then follow up right away with them within 7 days about them returning the fit kit. So reminding time period is very important, and the frequency as well.
Yes, sorry, go ahead.
Well, I was just going to add to that, that's really important, the reminders, and assuring that they have the instructions in the language that they could understand. So sharing videos in the language, or mailing them, or providing them a written document that really lays out very clearly in language to help them with the instructions.
That brings up a question that I had for Kimlin and for others, and that is about making materials available in other languages, both written and, as you were saying, Kimlin, I think, video for people who are lower literacy can be incredibly useful, not only for colorectal cancer screening, but for all of the subjects that we are addressing. So I'm wondering how people are trying to do that with different populations.
Yeah, thanks, Catherine. Yes, so it's through sending a link either to their phone, because most people do have cell phones, sending them a link with a video in language so that they can easily view a YouTube. But we also have written, sort of print that could be shared with them as well so that they can follow. And the reminder piece is so important. So I like that idea of calling 24 hours. So we will definitely add that to our implementation plan with our training for the clinic staff. And the way we are planning is to have all the clinic staff, not just the clinicians, but the scheduler, the front desk person, because all of these contacts and reaches can influence, patient quality care, patient adherence, a patient feeling that they are being welcome and thought of and cared for. So it's a whole system approach.
Yeah, I'm especially interested in your group. Your baseline screening rate was in the 50s, which is just tremendous. Was that 2019 or 2020?
So the California data is from 2018. Our local data, so that data is an aggregate of all of the FQHCs. And I didn't present it there, but the range is actually 27 to like 72. So we had a huge range.
Oh dear.
Yes.
Yeah, it's frightening that the state average now is 37%, which is, a marked drop from 46.
So I want to jump in here. We have a couple of minutes left, and I just want to address a couple of questions in the chat here. There was a question asked about, are the educational materials under the cancer plan tab? Kim, I'm not sure if you're referring to those that City of Hope has developed or that are using. And there was also a question, Kimlin, about those materials that you guys have, if they're on your website or not.
Not yet, but okay. That's the plan. And
okay.
Yeah.
And I just want to note too that we don't have any of those materials on our website. We're still updating the website, as you can see. And we will have a whole page for all of the cancer plan implementation projects that you heard about. And you can link to their organizations as well. So that will be upcoming. And, we have some support coming. So I know there's been a lot of stuff that's been pending, but now we can finally get some of this stuff done. So yeah, so I hope that answers your question, Kim.
I just want to add,
yeah,
if anybody wants any of the materials before, we post it on the web, please reach out. We're happy to share whatever we have.
Great. Okay, well, it looks like we're at time. This has been a great webinar. Again, I know it was jam-packed, a lot of information, but we only meet twice a year. And again, we'll have new staff coming on board. So look forward to the follow-up, and also just as we start getting all of these projects going that come out of the new cancer plan. Thank you, everyone, for joining today.
Thank you.
Bye.
Thanks. Bye.